Hey guys, it's Dan the Dog Man. Today's training session is going to be a little bit different. We're at Firehouse Animal Center in Round Rock working Kalani through a routine vet visit.
I don't think she's going to slip this, bro. As long as we don't let her.
I don't know. We'll see about that.
As we walk in the building, we hit our first moment of conflict. Sit. What? She sees the dog. So in these moments, I want to have a loose leash. Because remember, if I add tension and she's overstimulated, that could be enough to send her into behavior. Things start to build as we head back towards the exam room. And then the doctor finds out Kalani needs her anal glands expressed.
More interested. I didn't think too much of it.
That's
Was normal.
We've been sort of obsessed with licking in the vulvar area. And we're sure it's her vulva, not under the tail at her anal glands.
No.
Definitely under the vulva.
Yeah.
Because it's a different
Yes.
position when they, okay.
Right.
What we'll do is me and you will switch. We'll have the front end here, and then you can have the back end there where you have all the space.
Tell me to be in the corner.
Yeah. And that's really where everything gets tested. Good. So here, that's. You notice when I'm relaxing? If you own a dog with behavioral issues, you already know these visits can be stressful. Fantastic.
She's not going to like this at all.
She's not. So, are you guys okay watching this?
Yeah.
Okay.
Watching her is like
No,
traumatizing, but
Because her anal.
And once the procedure starts, well, you'll just have to watch the episode and see for yourself. All right, let's pause real quick. Muzzle came off.
Yeah, when you took her out of the crate, right?
Mm-hmm.
And it looked like she was getting ready to take a drink.
Mm-hmm.
And it looks like you went to adjust. And she just, what was that?
Yeah, so I mean, I kind of saw it building up, and I kind of anticipated that was going to happen. She was just a little riled up. I think it was first thing in the morning.
Yes.
Yeah, it was first thing in the morning. So typically after, sleeping all night, she wants to come out. I saw she wanted to drink water. I was adjusting her choke chain because that, I do that all the time whenever she's drinking water because her head's down. It's easier to just move it. And I think I just did it right at the moment that she was going to drink water, and it was just kind of a little spasm, right?
Oh, okay.
But if you notice, when she did it, I pulled my arm back and she stopped, didn't follow through,
Right.
and she didn't actually bite me.
I couldn't see because her head was in the way.
Yeah.
It was in a weird position, so it's like, what did you just do?
No, it just,
Okay.
I felt it. As I was rearing back, she did it. I moved my hand back. She stopped, and then I pet her just to kind of reassure her, like, hey, you're fine. I'm not mad, right? Because I wasn't going to correct her. She self-corrected.
Oh.
And then I adjusted, and then it was over.
Okay, cool.
So it was no big deal. But this brings up a good point, right? In the future, if things like that occur, don't take every little reaction as aggression. Sometimes it's just a reaction.
Okay.
And then you just look at her like, you good? All right, let's move on.
Okay.
So
Yeah, like I said, I couldn't see because her head was in the way, so I didn't know what she did to you.
yeah, she just snapped back. She just reared her head back. It's a lot of the similar stuff she does here when she's throwing her head back. It's just I came in and maybe I caught her off guard, or she just wasn't expecting me to in that moment.
Which at the beginning of it, that's what it looked like, but I wasn't sure
Yeah.
if she'd made contact or whatever. Okay, so
Yeah,
it's just
no.
like a whoop.
Yeah, just a little minor thing, nothing crazy, no setbacks, nothing like that. So in preparation for the vet visit, we've been muzzle conditioning her. We got her to the point now where she'll willingly put her mouth in the muzzle.
Kalani, muzzle.
Okay,
So that's good.
but has it been strapped on or no, the head just goes in?
Right now, we're just working on her putting it in. Today, it's just going to get strapped on, right? There's no ifs, ands, or buts about it. But the conditioning process is we want to associate good, with the muzzle, not bad. So we're working on that up front. That way, when this happens, it's not the muzzle that's the problem. It's whatever else.
Right.
What have her previous vet visits been like?
So when on her last visit, when they took the stitches out, they take her out of the room. I have no idea what happens, but he's a really good vet and he got it done very quickly. And he brought her in. I said, how was she? And all he would say was, she let us know that she was uncomfortable. He goes, but I got it done really quick. I don't know what that means. We never get a chance to see.
Prior to that, she's been good with, she'll growl.
Or the
when
head will
he's
go.
pushing on her stomach or something like that. And she definitely doesn't like anyone near her back end.
Oh yeah, she does not like to be.
Yeah, we know.
But yeah.
Yeah, we know.
Yeah.
But she hasn't snapped. She's growling. That may be because I try and be with her as much as, I typically will hold her.
Yeah.
And I know some vets don't like that because of the liability, but I look at it the other way. If she's going to bite somebody, I'd rather it be me than a vet tech.
Right, and they're just concerned about getting sued because it's happening on their property and things of that nature. I get it. I'm lucky enough to have found a vet that recognizes my expert profession, and I respect her expert profession, and so we're working together on this, right? It's a collective effort, and so it's going to be very similar to the vet visit with Bo. I don't know if you guys watched that one, the German Shepherd Great Pyrenees.
So both you guys are gonna. Okay.
Right, she'll be double leashed. We'll be both on slips, not to choke. She'll have her muzzle on, and we're basically just gonna work her through it. I don't mind if she growls. That's good. That lets me know what she's feeling. If and when she does react, we'll correct it and then continue with the exam. Biggest thing is the dog has to understand this isn't going to stop the exam.
Right.
I get that you're uncomfortable, but we have to do this.
Right.
So hopefully this is going to desensitize her. Also counter condition the behavior to the point where she goes, okay, this is ineffective. I'm just going to let him get it over with.
Right.
And we have been seeing progress from groom to groom to groom.
Good.
So she does get it. It's just a matter of making sure we do it correctly. It's going to be it's a 30-minute exam, so we're not getting seen for anything other than we'll bring up that concern you have about the licking, but we're just going there as a training session, right? Any questions, comments, concerns there?
No, and when she's gotten shots, she doesn't flinch. Shots aren't a problem.
Sure. It's probably just the pressure and the getting close and looking and everything like that.
It
So
does make me nervous that our techs will hold her by the head, and I really hate it when they do that. And these are small girls, and they think they have a hold of her, but she's still doing this. Right?
Is it-
This
is-
is one step closer to this.
correct.
Right?
Is it, and I mean, even throwing the head back, you get knocked out with that. Is it a fear-free clinic you're going to? Do you know that?
I don't know if he's a fear-free clinic.
Okay.
I don't know that.
So fear-free clinics, it's problematic because they mean well, right? Basically what they mean by fear-free is they don't want to cause any unnecessary stress, any unnecessary fear with the dog. And so they do wellness visits where they just let you come in and get used to being here. The problem is that doesn't prepare the dog for the oh shit moment
Right.
when there's pressure and when the conflict arises. Dogs need to go through stress in order to learn how to navigate it and come out of the other side.
Right.
So I'm hesitant to work with fear-free clinics. The one we're going to today is a fear-free clinic. However, I know the doctor personally. So she understands what I'm trying to do. I understand what she's trying to do. And again, it's a collective effort. What I would recommend is once this footage is posted and the video's out, you go to the vet and you show him, hey, look, this is how our dog has been conditioned to work through this kind of stress. This is what she needs. Are you willing to do this for us? If the answer is yes, fantastic, right? If the answer is no, maybe look into another vet. And it won't be that way forever, but at least for the next few times, as we get more comfortable, confident in controlling her and we trust her, that's what we want to do.
Right. Okay.
Okay?
He doesn't say anything about fear-free. Our mission statement is to treat all patients in a God-centered, family-oriented practice that provides compassionate, loving medical care that is of the highest quality.
Okay.
Also to be respectful and honest with every client that visits our practice.
Okay. So if that's the case, then they shouldn't have an issue, helping you work your dog the way she needs. Yeah.
I'll go under you, right?
Behind me, yeah. On the right. No, you got it wrong. So you want a cue. That way, when you pop, you see, hold this. You see?
Oh, yeah.
Okay. I'll hold him, yeah. Her ear's not through it. Needs an extra hole or something?
Yeah, I think so.
Just put it in the whatever hole it'll go. Yeah, make sure the straps are in the holders, in the metal things. There you go.
I don't think she's gonna slip this, bro.
All right, let's pause real quick.
As long as we don't let her.
Is that right?
'Cause that's fitted to Leo.
Okay. Yeah. All right, shut the door.
I got her.
All right. We're good. I'm good. All right, y'all ready? I don't know if, oh, that's the pet resort. Yeah, we want to go in there. Sit. What? Hello. We have a 2:30 with Dr. Davies. We're a bit early. Yeah. No, for Kalani.
Okay. You got a tea? Yes, I'll do. Okay, yeah, for Gizmo. Yeah, I was the one that you guys talked to. We thought you came for the See if anybody was interested? Or Kalani?
Yes. Sure. Oh, it wasn't on screen.
Oh, if you press that.
Oh, 6. Hold on. Place.
It takes a little minute to pop it up.
70.
0.7?
Yep. Free. I'll hold this for now. That way we're not crossing each other.
It sure sounded like a threat to me.
She sees the dog. So in these moments, I want to have a loose leash. Because remember, if I add tension and she's overstimulated, that could be enough to send her into behavior. So I'm just going to be prepared. If she goes forward, the leash will create tension, pop, and then I can correct. Ready for us?
I would, but I probably shouldn't. I think that'll look on top of that. So, give me 1 second though. I can see some. And I'll bring some extra chairs in here.
Perfect. Thank you.
I'm gonna bring some extra chairs for you guys.
Thank you.
Y'all can have a seat.
Yeah, y'all have a seat.
Yeah.
Who is Daniel?
That's me.
Okay. And I just want to make sure that this information is correct.
That is correct.
All right, awesome. I'll be back with some chairs.
Awesome. Thank you. So far, so good.
Was it difficult to get the muzzle on her?
Nope.
Not at all.
Went right on. Just had to make sure the fitment was good. Because on this side, you see how there's holes in the leather?
Right.
She needs like maybe 1 or 2 more holes to get a better fit. But the fit's there.
Right, cool.
Put those right there in the corner. Yeah. Appreciate it. Thank you so much. Yeah.
All right, take a be right with y'all.
Great.
Thank you.
Do you want us to scooch over?
Would that? Yeah, that'd be great. That way I can have the hall.
We're gonna scooch over.
Oh, okay. Yes, we can. Is this like kind of confident demeanor typical for the vet office?
Yeah.
She's a confident girl.
She, the one thing that's different is, you know, when she sees other dogs or whatever, or even sometimes if it's other people, she's pulling to go see them, right? She wants to go over there. She's watching the front door because we'll wait in the lobby. She'll watch the front door to see who else will come in, but she's always on alert, right? What's going on, who's coming in next, blah, blah, blah.
The other thing too is I made her sit at the door. She had to wait.
Right, we do that too.
So that
We
sets
make
the
her
tone.
wait. Right, but it's still, you get through the door and it just falls
Goes
over.
off, yeah. Well, this time it didn't, so.
Yeah, she was good. I was worried about the other little dog because, you know, that's been her MO. If she sees another little dog, she wants to get to it, right? Or another dog.
She was paying attention to it.
But she wasn't crazy like she has
I
been.
wonder if they have a room with a table because they're gonna want to get down on her level, and that's not. I don't want to do that.
Okay.
Might have to be
That table's not anywhere near
adjustable table.
big enough for her.
Okay.
Like with Bo,
That's true. Oh yeah.
we need something like that. We'll see what Doc says when she gets here.
Oh, you mean when she does the exam for like the
To
little
touch her,
bits?
yeah. Because having her up on the platform is going to prevent her from moving around, pacing, avoiding,
Right.
building the tension.
Yeah.
And then also, like when she goes to the back, Kevin and I can be in the front, controlling her with the leads.
Right, got it. Right.
But we'll see. We'll see how it goes.
I will tell you this. I don't know about you, but she's really calm. Normally, when we're waiting, she's like pacing the room.
Hey,
Hey,
how's it going?
Good.
Good to see you again.
Good. How are you guys doing?
We're doing well.
Good. Okay, Kalani.
Yes, this is Miss Kalani.
And we're just here for an exam?
Yeah, just it's a training session more than anything. This is her owner. This is Lisa. This is Belle.
Lovely to meet you.
Lisa did have a concern about her licking her private area.
Okay.
She says, you want to go ahead and explain?
Yeah, she's been spayed, had gotten spayed in November.
Yeah.
And shortly thereafter, I noticed that she was a lot more interested. I didn't think
Okay.
too much of it.
Ah, that's-
was normal. I kind of expected that.
Yeah.
The only thing is,
Thanks.
as the months went on, she would still do it, and then when she would come away, you get this waft of fishy smell.
Okay.
And I knew in the back of my head, I gotta get this looked at, but
Okay. Did we have a heat before we were spayed?
we did two heats.
Twice? Okay. And are we looking anywhere else?
No.
Itching, scratching anywhere?
Well, I mean, she does the normal.
The
right?
ears?
Yeah,
Do we
yeah.
lick our paws?
No.
No.
And the scratching is more contextually, it's just like a displacement type behavior when she's anxious or frustrated.
Okay, so it's like pattern.
Yeah.
It's like
Yeah, yeah,
yeah.
behavioral.
Yeah.
Okay. And what does her vulva look like? Is it red, irritated?
No.
Okay, unsure.
won't.
For before she came in, yeah, so there's a biting issue, right? She was not used to being handled, and then she hadn't been groomed, so the area wasn't properly, taken care of. We've shaved away at certain areas. I'm not sure if we got the bulba or not, but we can definitely, if we can examine her today and just kind of.
I wouldn't mind you looking at her her butt too,
Yeah.
just to make sure that it's okay back
Yeah.
there.
Absolutely. Okay.
She's very sensitive about that area, so I'm just letting you know.
Yeah.
I did have a question.
Mm-hmm.
Is there a room that has a table big enough to get her on it? Because I would prefer her going up on a table versus you guys coming down to her level. If there isn't, we'll make do, but.
No, they're all this size. We do have our x-ray table, but that would be it out back in the exam room. It is less space. The table itself is big, but like for everyone to be in it, it's a little bit smaller. Like,
What about just us and you and the vet? Is that enough space? Just me and him?
it could be. I can talk to Dr. Davis and we can like kind of
Yeah.
go through what might be a better idea. Cause yeah, this one she's not going to comfortably.
Yeah, no, she's too big for it.
Okay.
And I just feel like all of us crowding down in her space,
Yeah.
it's going to be a little bit more difficult.
Yeah. And I don't have to do much for the exam if you can at least like have her stand in
Yeah,
the
we
safe
can-
spot or someone hold her tail.
We'll
like,
be
yeah.
holding and handling. Doc will be examining.
I don't necessarily need to like engage with her or like be in her space. All I'm really gonna be here for is like Dr. Davis needs tools.
Yeah.
You know, since you guys
Observing.
are going to provide the like holding, handling, I won't need to necessarily do much.
Okay.
So, but we can definitely talk. I can definitely ask Dr. Davis if she has any ideas on what might.
That'd be great. Thank you.
Okay, and then I'm just gonna ask you some generic questions since we don't really have history for this animal. How are our other behaviors? We eat well?
Yes, we eat well, poops well,
Okay.
drinks well. Yeah.
Good. No vomiting, no diarrhea.
If she eats too fast, she'll
Okay,
upchuck.
but it's just food.
Yeah.
Okay.
Don't move your hands. Have her respect your space. Good.
What kind of food do we feed?
Fresh pet
Okay.
and Jinx salmon, wet food.
Are we on any flea, tick, heartworm prevention?
Yes, she's on Tri-Heart and she's on a fipronil.
We just administered the last one. Was it the 4th or
Yeah, third or fourth.
third or fourth? Oh, you did it the second?
Beginning of
Okay.
April. And she's been on them consistently.
Okay, awesome. Any other meds that we take?
She gets, she hasn't for the last 8 weeks, but typically she'll get glucosamine.
Okay. And you said that you guys adopted her. Is that correct?
Right.
How long ago?
We got her at 8 weeks.
8 weeks.
Well, you bought her from a breeder, right?
Yes.
Okay.
She came from Brita.
Yeah.
She was born June 11th.
June 11th?
24.
My birthday's June 12th.
Mine's-
Twins.
Mine's June 1st.
Oh,
Hey.
twins. Geminis.
Okay. And time frame after we got spayed that we started seeing it, was it immediate?
It was
or-
not immediate.
Okay.
It was probably a couple of weeks. And you know, in her heat cycles, she would be interested, and you know that's just normal
Yeah.
during the heat cycle.
Yeah.
But it seems like after the spay is when she got really interested in what was going on down there, and it's like, well, I just want to look, but she wouldn't let me.
Where did you get her spayed?
At our vet in Lubbock.
Okay. And do we have records?
You won't have records, but he does.
Okay.
He has.
Odin Veterinary.
Yeah, Odin, O-D-E-N, veterinary.
I sent Dr. Davis a copy of the records.
Cool.
Oh, okay.
Yeah, I forwarded the ones you sent me.
Oh,
I
okay,
had
cool.
sent
Cool.
records down.
Okay. Awesome. I think I have everything I need. Let me go talk to our doctor. You guys are a little bit early.
Yeah.
Okay, yeah.
Yeah, but let me go talk to her, and then we'll be right back.
Okay.
Okay. Fantastic. She saw a dog right before she got up, started targeting. That's. And then also when she's like this, I don't need you to do anything, but you see how she's pressed up against you?
Yeah.
So when a dog does this, it's because if they feel where you are, they don't have to see where you are. The moment you move, they'll look. So this is almost kind of like a guarding, posturing type of behavior where they're just like, and then if you move, they'll look, but if you don't move, then they're just focused on that.
Okay.
Does that make sense?
Move?
Right now, I don't want you to do anything. If this was like she was targeting a dog or a squirrel and she did that, fuck off me. Like I would nudge her off me, right? To let her know, don't do that. And then that's just one less advantage she has.
Okay.
Here, just because of a limitation of space,
Right.
I get it, right? Like,
Yeah, there's only so many inches here.
yeah. So far, so good. That went really well.
Yeah.
A big thing was she didn't acknowledge the dog.
Right.
She didn't come in here like your typical vet take, oh my God, honey baby.
Right.
And so,
Yeah, it's funny that you say that because the techs, as soon as they see her, they're all like, and then the jumping will start, right? And then the pulling will start because these are my friends. I want to go say hello, and it's a nightmare. And the girls all speak with a high voice, so they get her going, and it's like, just get us into an exam room. That's all I want you to do.
posture, the tail. Loose leash.
Typically the door is a solid door, so she can never see out of it, but she's always watching the crack.
Well,
right?
she can hear, she can smell.
Hear, right?
Yeah.
Yeah, she's looking for something.
So there, she's trying to get a better view.
Yep.
But again, I have a loose leash, but I'm ready if she goes forward. And there's a crack she's on. Do you see it? Right. So I'll use something like that as a guide, right? If she goes past that crack, I know that she's going towards the dog. But if she chooses to check in, lay down, do anything else, there it is.
Okay. Yeah. I mean, before this, when she would do that, the leash is always tense. I mean, she's always pulled it out to the thing.
And that's because you're anticipating,
Exactly.
she's anticipating, and it's just a giant conflict. Here, I'm like, okay, I'm anticipating, but we train, we don't restrain. It's not about keeping the dog from doing anything. It's about guiding the dog to the right decision.
Okay.
Does that make sense?
Yes, it does. Well, it was something that I heard when they're training officer canines. They do this restraint because it's anticipatory for the dog. They know that it gets them riled up to go after. Right? You know what I mean?
It's opposition reflex.
Right.
The more I pull back, the
Right.
more the dog wants to go forward.
Yes.
And so you do that little boom, but it's kind of like a game of tug. And then when they really want to pull, you let them go, and they go with full intensity. So that's why I don't have tension on the leash.
Okay.
But here she's just observing.
Right, and it's funny because
Curiosity.
Mm-hmm.
she knows what to do, right? It's interesting. She knows what to do, not to go to the door or what have you, blah, 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 blah. You don't have to restrain her.
And I didn't tell her stay, stand, sit,
Right,
down.
Yeah.
Behavior over obedience.
Right.
Eventually, because of all the work we've done on settling, she'll come to the conclusion, I should probably just lay down.
Right. Like it looks
Like
like she's trying to.
Yeah. She's thinking about it.
Yeah, she is. Until, another distraction, what have you.
So this is just a matter of her being comfortable in the environment enough to be vulnerable to lay down.
Right. Okay.
Yeah, because there is a little bit of that too. She's in a strange environment, so.
Yeah. Well, but also it's neutral environment, right? She has no history here,
Right.
so she's going to be less confident in being herself.
Right. Whereas with our vet, she knows everybody there. They know her. The high voices get going. Blah blah blah. They come into the room. Oh, hi, pretty. The whole nine.
The whole nine, exactly. And this is why I wanted to do this, because it's a good opportunity. Bam, good girl. Love it. And then you don't need to reward with food or anything. The praise is enough for her to hear, okay, and then she feels better. So just allowing the dog to do what they're doing is also a form of reinforcement.
Right.
So far, so good.
Now, in the lobby, so we go in, we check in, and we sit in the lobby.
And you would settle while you wait to be called back.
Okay.
And I like to pick a position where I can see everything.
Right.
Nothing's gonna sneak up behind me, to the side of me. Maybe I have a wall next to me.
Right.
Just to, be precautious and safe. And we sit and we settle. And then when we get called back, we just walk back. Doesn't need to be in a heel, right? But a little bit more controlled than a loose leash.
Right.
And then if there's opportunities to address a behavior, I will. If not, we'll just come back. And then, luckily, these are that vet tech that was here. She's one that I met with that cattle dog I told you about.
Okay.
And the doctor that's coming in, she's the one I met with. So they kind of know. I already told them, don't talk to the dog. This is why it's going so well.
Okay.
So maybe just ahead of time, hey, do me a favor, I know your vet techs want to be nice, but just ignore my dog. Talk to me in a normal voice. Don't get high pitched. Some vet techs will take that personally. I can't tell you how many appointments I go to. They come in and I cut them off. Hey, please don't talk to my dog.
Right.
And, they look at me.
Right. And we don't want to be mean, but at the same time, it's like, well, I can't have her going off the rails.
I care more about my investment in this dog and her
for
results
sure.
than I care about your feelings.
For sure. We have to look at it that way.
Yeah.
So how old is the Australian Shepherd?
Yeah, is it a pup?
It's like between a year and 2 years. It looked really young, like a year and a half max. Year and a half max. It's an Australian cattle dog. But that dog will do best in an only dog home because of that level of tude we witnessed.
Right.
That's one of the more confident dogs I've seen, and the dog hasn't even reached maturity. So you can only imagine once it's 2-3 years old,
Right.
the level of intensity that's going to come with that dog.
Right.
I personally think that dog bit the owner because maybe she fell on him or it was just a redirection. It wasn't actual aggression.
Intentional. Right.
Yeah. Now the dog did puncture the woman, and she did have to go to the hospital to get stitches. So I also understand the gravity of the situation of why they would want to, but not enough to get put down in my book.
Right.
Because it's very circumstantial.
Right. Yeah, this is crazy.
She's doing well.
She's doing
So far, so
very
good.
well.
This makes you happy?
Oh my gosh. Yeah.
Yeah, it's crazy how just like settling before we do anything, how it just translates to life.
Right. Right.
Teach the dog to do the skill there so that she can apply it here.
Everywhere.
Right. And now think back to our initial lessons and how hard and time consuming and how long it took for her to get settled like this. If I had just let you say hi right off rip, we would have never got here.
You're right. And I know that as hard as it was, I know that. I absolutely know that.
And you feel way better about this.
Oh my God.
Yeah.
I wasn't doing her any favors by reinforcing her the way that she was thinking. I wasn't doing her any favors. But it was funny, Bill and I were talking in the car. It's really funny how we now have to think differently, right? Not using obedience for behavior. We have to think, like before when she was like fence fighting, come here, come, right? Well, we know that doesn't work. We understand why that doesn't, and it'll never work, and why she continued with the fence fighting and blew us completely off. The leave it commands, why she blew us off, right? It totally makes sense, and we have to change the way that we interact with her, right?
The best way to modify somebody else's behavior is to modify your own.
Right. It's a lot to remember. It really is.
Do you see now why I do only 4 weeks and up?
Yeah. Oh, for sure.
Yeah.
For sure. I mean, that 2-week board and train that she went through, all that did was teach her those 7 commands that he had.
With that guy.
With that guy. With that guy, right.
In 2 weeks, we had her doing everything we wanted. But how does that transfer over to you?
Right.
It doesn't. We're just at the precipice of making any kind of impact.
Right.
And so now 6 weeks in, I mean, you have a different dog.
Right.
And so when you guys take this back home and you start to do the same things and apply the same structure, you're gonna run into some speed bumps. Progress is never linear. But if you stay consistent the way we stayed consistent, this is the dog you're gonna get out.
Right. Stay consistent, take emotion out of it, right?
Well, so it's okay to, is it feign emotion, fake emotion, right? Just don't be emotional.
Right.
When I'm correcting, I look angry, I'm using the face, I'm doing the things, and then they stop, yep, that's right. But I'm not actually angry or upset or frustrated. I'm just acting it. People are emotional. They wait to get to that point. Yeah, she's like, what the fuck is this? They wait to get to that point of, I'm so fucking pissed off. Now I'm going to give you the consequence.
Right.
And then, yeah, the dog listens, but you just made that very unclear because you allowed the dog to do all this.
Right. Right.
And you know what's crazy is I went to a dog training school, a professional dog trainer school, got my certification. They didn't teach me any of this. And you have an industry where everybody's worried about what certification you got, what letters you have after your name. And they don't even understand what a dog is.
Right.
They know a method, a technique, terminology. They sound smart, for sure.
Right.
But when it comes to technical application and transferring the knowledge to the client, there's a huge disconnect.
Right.
And most of them don't talk to the clients.
No, they instruct the clients. Push this button, give this command, give this correction.
Right.
That's instruction versus teaching.
Right. See, I don't know about anybody else, but I learn better if I know why. Why are you doing it that way? Or if you can apply some of the analogies that you use. Oh man. Some of the life analogies.
Right.
Life analogies.
Yeah.
Me and him were talking about that.
Right?
Yeah.
People have been giving me shit like you're human, you're being anthropomorphic by giving those human analogies, but I'm like, no, because I'm not humanizing the dog, I'm humanizing the experience.
The experience.
The understanding, the
My
education.
career, you know, I've trained or had, without exaggeration, more than 150,000 employees in my career. Okay, you have to bring it to something they understand.
Right.
And a life experience is the only thing that
Exactly.
they understand.
Exactly.
Like that analogy that you use, stack your trays.
Yep.
Oh my God.
Oh, with the veteran?
Yes.
When I say the phrase, stack your trays, what do you feel? Okay. Do you know why? Because it was the drill sergeant cutting your meal short and telling you, get the hell up and out of my chow hall. So what you just said, when you would say the command, he would get spooked, is because you're labeling that stressful event. And now every time he hears it, that's the predecessor to the stressful event. Yeah.
It's like, oh my God. And when you said that, I'm thinking, that's the leave it command.
Yeah. You're
When
labeling
she
the fight.
hears- You're labeling the fight. When she hears that, it always ramps it up. It has always ramped it up. Unless we were in the house where nothing's going on and we want her to not mess with something or whatever. But there's no other distraction. Well, when she's going after something that she really, 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 really wants, right? Leave it will never work,
No.
right? So when you start talking about the stack your trays, I'm like, oh my God.
And he knew exactly what I meant.
Yeah,
I feel
couldn't
anxious.
hear what he was saying.
He said,
but
I feel
saw
anxious.
his face because his whole body just dropped.
Yep.
Right?
Yep.
I'm like, oh my God. Wow.
Yeah.
That was crazy.
That's what happens when you've lived an eventful life. Is you got a lot of experiences and a lot of analogies, and most of the time I'm just freestyling. I'm just like, okay, this reminds me of this one experience I had. Maybe you'll understand it that way. Boom, and it lands most of the time. Sometimes it doesn't.
Yep.
Sometimes I miss.
Well, I've never even been in the service, but the moment you said that and I saw his face, it's like, oh my God.
You haven't been in the service, but your parents were both in the service
I meant
for a very long time, so.
But that's good that even that analogy stuck with someone that hasn't experienced it.
It was freaking crazy.
Because you can visualize it, process it, and go, oh, okay, yeah, that makes sense. That's what it is at the end of the day.
Yep.
I gotta make it make sense to the average dog owner. Not everybody's a dog trainer that needs to understand the science and the terminology and all these fancy things. You just gotta make it make sense.
Right. Right.
She's being a good girl.
Yes, she is. Oh, she's tired too.
Yeah,
She's exhausted.
That's why I didn't want to push her any more than we did, because
she really didn't want to come out of the crate.
Really? She was relaxing?
Yeah.
I'm busy, Kev. Leave me alone. That's funny.
Yeah, I know one of the things that every now and then you use the wrong life experience with someone, and it's usually with the younger generation. I would say something and they just look at me like, what the fuck are you talking about?
So she's got one more groom down after this?
yeah, before she goes home, we're gonna do her final grooming. Just make sure everything's good. We'll get in between the paws, trim her nails, do all the stuff.
Trim her nails?
Yeah. Trim her nails, clean her ears. No, we haven't had to.
Yeah, she hasn't, because her walks every day with us anyway, a lot were on concrete.
Yeah.
So she hasn't had to have a nail trim.
I can't even imagine what that will look like, but
No, it'll probably be all right by the time. Yeah.
I think with
I just hate black nails.
all of her progress up to this point, she probably will be all right.
She'll. I mean, there'll probably be a little bit of a struggle, but it won't be anywhere near as intense as what it's been. And as soon as we correct one paw, the rest of the paws will be fine. There's a dog wagging his tail on the other side. She's hearing it.
Now, is this the same vet that you took Bo to?
No, this is a different
I
vet.
was going to say, because the room was huge.
Yeah, that one's in Wimberley. It's like over an hour away.
Got it.
If I hadn't made this connection, we would have gone there.
Okay.
But this was closer. It's right by your hotel, so figured I'd make it a little bit more convenient.
It's cool. We would have drove.
I know you would have, but. Hello, how you doing, Doc? Good to see you too. It's going great. This is Lisa. This is Bill.
Hi, Lisa. Hi, Bill.
This is Kalani.
Nice to meet you. Oh, she's gorgeous.
Yeah, pretty girl.
Oh, you look so good. How are things going?
They're going great.
Good.
She's doing very well.
Good.
Do you have questions about her that I can answer for you?
So Jade gave me a pretty good summary of the history of what y'all have been dealing with. A couple weeks after her spay, we've been sort of obsessed with licking in the vulvar area.
Mm-hmm.
And we're sure it's her vulva and not under the tail at her anal glands.
No.
Definitely under the vulva.
Yeah.
Because it's a different
Yes.
position when they, okay.
Right.
I do want to mention the first week she was with me, she was severely matted, but in the hind legs and the buttocks area. She was having trouble pooping, I think because the poop was getting stuck in the hair, and I think there might have been some kind of acid burn on the glands.
Okay. Yeah.
We cleaned it up, and I looked at it. They didn't seem like there was an infection in the anal glands or anything. That's separate from what she's talking about, though.
Okay. Yep.
That happened 2 weeks after the spay.
Okay. And how long ago, remind me how long ago this day was?
November.
Okay, November. Okay. And any scooting?
No.
Okay. Urination seems normal?
Yes.
Okay. And normal stools?
Yes.
Okay, perfect. Okay, good. And how is she when you all try to look at that area?
She doesn't let us.
She does well. So with them, they haven't handled her since the training.
Yeah.
With us, we've done 3 pretty moderate to severe grooming sessions with her of chipping away at it.
Yeah.
There are a couple of outbursts initially, but once we work her through them, she's very tolerant and she does okay.
Can you give me some gloves?
I brought these. These are Armor Hand gloves.
I mean, just
Oh,
just
okay.
because I'll be in an area where,
Yeah, that's right.
She needs some
Sanitary.
So for us, we don't have any other really probably tables like at that other video
Sure.
you had where they kind of had that table that was like adjustable.
Yeah.
I typically just get on the ground.
Okay.
So, if a dog is not amenable to kind of laying down and rolling on their back where we can look, which is common, I'm usually just trying to get underneath them and take a look.
So what we'll do is me and you will switch. We'll have the front end here, and then you can have the back end there where you have all the
I
space.
think that sounds great.
So I'm gonna be in the corner?
Yeah.
Oh, okay.
So, give me 1 second. I have a couple more questions.
Oh, okay.
Sorry. So just before I get in that area, there's some. Does she have any history of allergies, licking paws, being itchy anywhere else?
No.
Okay. Because one thing we can see is like a perivulvar around the vulva dermatitis.
Okay.
So that can sometimes be related to allergies, and obviously that area gets, it's tucked in and moisture and things like that.
Right.
So,
Right.
So those are kind of the things, and it's just gotten worse over time. Same, better.
Well, I haven't seen her for the last 7 weeks.
Okay.
But when she was at home with us, it could be 2 or 3, 4 times a day. Where she'd be laying.
Not just normal grooming, seemingly.
Yeah, it
all
didn't
the
seem.
time.
She seemed bothered by it.
Yeah, I agree. Because dogs do some normal grooming once or twice a day, but then that should be the extent.
But then the other thing is, there'd be sometimes where she'd stop and you'd get this waft of fishiness, and I'm like, I need
metallic fishiness is anal glands.
Okay.
If a metallic fishy smell is like a classic anal gland smell.
Huh.
So now urinary
She's
tract
not
infections.
reaching back that far.
No, well, and urinary tract infections. Sometimes when dogs urinate, and we've collected urine, if they have a severe E. coli infection, it will smell fishy as well too. So I don't know that we're 100% sure. So maybe once I take a look at everything, we'll talk about anal gland expression. Let me just get an exam, and then we can talk about collecting urine sample and just making sure that we don't have some, overgrowth of bacteria.
Got it. Okay.
Typically, urinary tract infections cause increased frequency of urination, straining while urinating, urinary accidents, either with y'all or at home. So I wasn't hearing any of that. So, okay.
Yeah. No.
Bladder infections.
Nope.
Okay. So we'll start with that area, and then I'd like to look at the rest of her after we do that. So, thank you. Tell me, but he's gorgeous.
Just trust us. I mean, you can handle her and just here. I got this actually. Yeah. You can hold on to that back end just in case.
I'm going to gently, there you go, girl. So, what
Can you help her actually? I'll control the leashes and you help her. I got this.
What I would typically do
Help
is
lift the.
Yeah, lift her butt up.
She is beautiful. I grew up in Alaska and we had huskies and so on.
She's our second now.
So Bill and Lisa, I want you to pay attention to how I'm handling this front end. So I'm basically just counter steering. Good.
Jade, I very gently hold her tail.
Good. So you tats. Relax. Good. You notice when I'm relaxing, right? I catch the impulse. So I'm just talking to them, yeah. But I catch the impulse, and then when she relaxes, I relax.
The skin around her vulva, and I felt her vulva, everything looks normal, okay? So I want to check her anal glands.
Okay.
Which she's also is invasive, so do you want to bring the kit? Yeah. So let me check the anal glands and see if those are removable. So, but I didn't,
Okay,
none
good.
of that, when I was touching her in that area, it was the same reaction as just being back there. So there wasn't any really indication of pain.
Yeah, she
associated
doesn't
with the
like
vulva.
anybody.
Yeah.
Yeah.
But the fishy smell, that we definitely want to check the anal glands.
Okay.
So
Okay.
Wow, I didn't think she was reaching back that far, but
Well,
hey.
I mean, honestly, if you could get some videos, hopefully we fix it.
Right.
But if you're ever in those situations where you're seeing these things, just get some videos. I mean,
Okay.
just for funsies, right? And that way, sometimes I can get more information out of that. Sometimes, not always.
Right.
Limping when this dog before y'all has having weird head tremors, so the owner's got me some videos, and it's nice that I can see that because it's not gonna happen here.
Right.
So, but yeah, so.
Cool.
She's really pretty.
Thank you.
And this is definitely a lot of brushing and grooming and maintenance. and
All the
yes.
time, yeah.
So, okay. So
Pull her
we
back
have,
in towards
one
you.
more thing, just the ear cleanser. That would be great. Sorry, Jake. So when we do anal blends here, we do them internally, so I'll be feeling and checking everything, and if they're full, I'm going to empty them.
Okay.
And that would honestly be the easiest fix,
Sure.
if that's the case. So, and then she would just need potentially regular anal gland expressions every.
I always heard that was, unless there was a condition or a reason for it, doing it unnecessarily.
You don't do it like empirically. You would do it when you start seeing symptoms.
Okay.
So the smell, licking, scooting.
Okay.
Right. And a lot of dogs will scoot, but not all of them will. So
Right.
that's sometimes misleading. People are like, well, so. But we'll check. If they're empty, we'll go back to square one. We may try and get a urine sample.
Okay.
So.
Perfect.
Okay. All right. So that everything that everybody was doing before was really helpful. So.
Okay. Fantastic.
She's
So-
not gonna like this at all.
She's not. So are you guys okay watching this?
Yeah.
Okay.
Well, I am.
I'm not. I'm
But
okay
it's-
with you.
yeah.
And just watching her is like
No. Yeah. No.
traumatizing, but
I know. And it's what I'm doing is, it's not. It's awkward. And,
Right.
And a little uncomfortable. It's not like painful.
At least buy me dinner first, you know?
right, give me a cigarette or
I
something.
hate to say it this way, but been there, done that.
And she's how old? 20.
20 months, 21 months?
Yeah, June shall be.
All right.
Ready when
So
you
yeah,
are.
Jade, you'll come around and hold the tail from. I think this angle would be better. So go ahead. And gently lift her.
Good girl.
Because her anal. They have not.
All right, let's pause real quick.
Okay.
Muzzle came off.
Definitely the left one is full. I didn't get a chance to fill the right one. But
Can you
that-
put the muzzle back on?
Yes.
Yeah, this is just not something a dog should normally be okay with, right? So.
Good
it's-
girl.
right.
Good job.
So it's understandable, but everybody's reaction is different. You were so
Is
smart.
there?
I knew you would need an extra pair.
Should I use this
Yeah, I was gonna say if we can try to. Yeah.
to hold her up?
Well, no. Let me see the leash real quick. I'm gonna ghetto rig this.
Use it to hold the back of the muzzle. to the-
Yeah, so that doesn't fly off like that again.
Sorry, girl.
I appreciate your patience, Doc.
We got lots of time. My next room, who is a German Shepherd that I usually have to sedate, he rescheduled.
Oh,
Oh, okay.
Oh, nice.
well,
Okay.
perfect.
Sweet.
We always schedule an hour for him because
Difficult.
He's a problem.
he
Mm.
just retired a lot. So that's okay.
All right, let's do this.
Ready?
Yep.
Sorry, baby. Oh,
Ready when you are.
1, 2, 3.
Relax.
Almost done. Okay. Let's release. Okay. I
Good.
normally do more cleaning, but I
Good.
didn't. I just wanted to stop.
Good.
They were both fairly full. Yeah. Express normal material. Can you get me some Rocal? Smell. Just
Yes.
Smell.
Okay,
Yeah.
now that's what I smell.
Yep.
Do you smell it? That smell. The kind of smelly smell. The smelly smell that smells smelly.
That's
All
that
right.
fishy smell.
That's honestly, I thought it was her vulva that she was.
They're in the same area.
Yeah,
so
okay.
it's-
I didn't realize they were
so close.
When dogs, typically, if a dog is bending around like to the side, that's usually an under the tail thing. If they're going like this,
Okay.
it's usually the vulva.
Got it.
So,
Got
and
it,
I only
got it.
know because I have a dog. I have a bull terrier. This is my bull terrier, Miss Piggy.
She's pretty.
Yeah, she's an awesome dog, but she has bad allergies, and she has I had to remove express her anal glands all the time. So
Right.
I could tell which direction, whether it was like this or like this.
Got it. So now, how often?
Based on symptoms.
Oh, based
So,
on symptoms.
Based on
okay.
symptoms. So it may be that it's a year from now. And I can clean her up if we want to do that, or just not worry about it at the end. We do a little ear wash and a little deodorizer spray, but it's up to
No,
you.
you're fine.
Okay.
We're gonna groom her before she goes home next week. So
Okay. I always tell people anal gland day is a good day for a bath if you were considering doing a bath. Because it's hard to get all of that smell from the fur. And she was pretty good. I emptied them either 100% or 90%. I mean, I always felt like I didn't get as much time as I did with other dogs, but she was doing so, I was getting it, and I wanted to kind of get her through that. So it depends on the symptoms. Just like Daniel was saying, it's not something you need to like schedule every 2 to 3 months and come in. I would go based on the symptoms. So hopefully, give her a day. She might want to lick back there for a while, but hopefully after a day, 2-3 days, she should not be licking nearly as much. And then you watch for the fishy smell, leaking, screaming, licking.
Okay.
And that's when you know she needs it again.
You're
If
so
it's every
good.
6 months or every year, and you guys are working on training and she's maturing, you know, that's great. If it ends up being a situation where you're finding that she physically needs this every month or two, and it's this stressful all the time,
Sedation.
no, we can talk about, we're not there yet, we can talk about surgical removal. She's a young dog. By the time you come in, and this is not a tech visit type of dog, this is a doctor visit.
Yes.
Express anal glands, by the time you do that, I'm jumping way ahead. But I have seen that where it's like over the years, if we spend 10, 15 years doing anal gland expressions, surgical removal is, and most dogs do fantastic. My bull terrier had hers removed, and I'm grateful every day. I mean, not every day, but you know, so we're not there yet.
Yeah.
Right. She could go a whole year or however long.
Okay.
So, but if you find yourself in that situation,
Right.
I did have a husky patient, we had to sedate her every time we had to do anal glands. And it was very stressful for the dog. She was like 2 years old, and I was like, we should talk about this. And that is not a surgery I do, that is a boarded surgeon typically that does that, so. But
Now,
Good girl. There you go. That's what I was hoping we'd have enough time of you being here and her settling,
yes.
just so that there's not a super negative association to you. You know.
so what causes them to fill?
So the anal gland is a gland that sits just inside the anus around 3 or 9 o'clock, 4 or 8 o'clock. It's a scenting gland, so whenever a dog has a bowel movement, that gland should empty, and that's why dogs like to smell other dogs' stool. It is a scenting marking gland. We have domesticated dogs. We have done all different types of things with them. We've probably changed things over time. So some dogs just don't empty normally, even if they have normal stools. So if a dog's
Even if they have normal stools.
if
Okay.
a dog's having diarrhea or soft stools, that makes sense that they wouldn't empty normally.
Right.
So you can add fiber to see if you want to bulk up the stools a little bit more. So fiber sources,
Psyllium.
huh?
Psyllium.
Yes, psyllium husk is actually a good one. I was gonna say people like canned pumpkin, but canned pumpkin actually doesn't have that much fiber in it because it's got a lot of water in it. It's fine and it's safe, but it's not as much fiber. Psyllium husk is great. Fiber One cereal, and dogs usually like Fiber One cereal. It's actually a good amount of fiber. And if people always ask about the supplements, like the Glandex and the anal gland supplements, and I'm always like, if they work, come tell me because I don't have any evidence that those are going to help. And in rare cases, sometimes it's associated with allergies, and those dogs eat a hypoallergenic diet. But y'all have not really described anything else, and this is the first time we've done it, so it may just be maybe we'll get lucky, you know. And so
We're familiar with.
yeah.
We're familiar with
Our first now had IBD.
Yeah, so exactly. So
That was a daily
it can form
occurrence.
kind of a gel, but so I don't know what you all mixed it with.
with our wet food.
Okay, with wet food, perfect. And then I think after the spay was probably just coincidence,
Right,
you know. So I think it was just So I'm curious to see after she gets cleaned up if this resolves our symptoms.
Yeah.
What I hope is that we get 1, 2, 3, 4 months or whatever that looks like, but it's she'll probably need them expressed again in the future.
You know, it's funny how you were saying the differences of being hunched over. I just realized it's always been.
Yep.
And
it's
I
under
just
the tail.
assumed
Sure.
because it's in the same
It
area,
is in the same area.
right?
It is in the same area. It's not like a male dog. With a male dog, it's much easier, right? The anatomy's further away, so you can really see what they're looking at.
Okay.
But female dogs, it's But this,
Got it.
honestly, this is, at least we know. So, and the material was normal. Sometimes I get, when I do this, it's bloody or
Right.
it's infected, and they're hard to treat systemically because it's a walled off gland. So systemic antibiotics don't work very well. So it's not that we don't treat them with antibiotics. It's just that usually in that case, eventually I have to sedate them. I flush out the gland. I infuse it with an ointment to kind of get everything calmed down. So, but yeah. But if you're spinning your wheels over time with this situation, and hopefully that's not the case, there are some other options.
Okay.
So,
Awesome.
Yeah.
Awesome.
I'm so glad you checked. Thank you so much.
Yeah.
Now I know
Yeah.
the mystery is over. I knew there was something wrong because of the smell, but I just, I knew I had to do something, but then the training came up and it's like, okay, this is like way more important right now.
Yeah.
Well, this wouldn't have been possible without the training.
Yeah.
You think? Oh yeah.
Oh,
Sure.
she was terrible.
Yeah.
She was terrible.
Yeah, and that's going to take time, and hopefully, like I said, it's, and the training with the basket muzzle, I talk to owners about that all the time, because having a well-fitted basket muzzle that they can already be familiar with, and so us trying to put one on that maybe doesn't fit quite as well, and they're not as nice, I mean, just to be honest, because we go through them so fast, we can't.
Right.
But I have some dogs I have this one dog, she's a border collie, and she is very, very, very likely to bite. She comes in on our basket muzzle, as long as we get away from the owners. She can be a drop-off, she wears the basket muzzle in the run, we can do what we need to do with her, it's pretty amazing.
Right.
And I
And
know other
then
dogs
do you all do the same thing that these guys do when you're?
We don't. Our staff is not trained to do that. So
Okay.
typically what we're doing in a situation, maybe not with Kalani, but like a similar situation, is if we have a muzzle on, we would probably have somebody holding towards the front. We're doing lots of ear rubs, like base of the ear. There's an endorphin release, like a teletouch therapy. Treats if we can. Somebody else is holding the body for me, but it's not, we are not trained to do that, and you have to know when to release and when to not release.
Right.
To not cause trait. That's why I was trying to explain while it was happening. Notice when I release, I catch the moment she does it, and then I relax and I catch and I relax, because you are applying pressure to the trachea. You don't want to cause trachea damage. Correct me if I'm wrong, but there's about 10 to 15 seconds of opportunity there.
And your timing has to be pretty impeccable.
Yeah, it's
It does.
some savvy.
I'm kind of good,
It
just a little bit.
that takes practice. So our team is, ours is like as many treats as a dog will take, and she may be too stressed to take
She
any
wouldn't.
treats.
Yeah, she
So,
refused.
yeah, would she take something now? Could she have it be?
Yeah.
Yeah. So and then we use a lot of medications, right? Pre-medications and sedation. So.
Yeah. I mean, I'm always a firm believer that if it's like life, limb, or eyesight, you can certainly sedate the dog if you need to get something addressed.
Yep.
Medication just takes the clarity out of it most of the time. Like with Bo, he got worse with medication. He became way more rabid with medication.
Yeah, some can get worse. It depends on the dog. Some of them it works really well for, and you're kind of surprised. And then sometimes it's, I know she has to work too.
Can you get it?
Can she have peanut butter or cheese?
Yeah.
She can.
Yeah. She would probably love it.
I have chicken churu too.
Huh? It's really weird because with our first male, she could only have certain things.
Yeah.
Peanut butter, cheese, one bottle.
Yeah.
She was on a novel protein diet.
Yep.
Bison and venison. So now when I go in the store and I look at things, it's like, oh wait.
She can have
She can have that now.
She can have chicken.
Oh, pretty
Yes.
girl. Pretty girl.
Yeah. So, and I have some information.
We saw no basket.
Well, and that also the basket muzzles help because they're able to actually eat treats and drink water.
Right.
Girl. He's like, oh, that's yummy.
Ooh, hot dog.
Yeah.
She's like, you bought me dinner after.
So the fact that she's taking treats definitely indicates that she's like at a lower level of stress.
Yep.
And they know, they're smart. They kind of know when things are done.
Mm-hmm.
Right.
You know what I mean?
Yeah,
So
yeah.
even if it's just an exam, they know kind of, okay, I can relax a little bit. She's like, oh, I gotta work on this. So, what questions?
I'm probably gonna have our vet contact the office, because she was due for a biannual wellness anyway. So I'm just gonna, he'll want to know about this visit.
Yeah, so what I
Right.
can do, so right now we have it under, everything kind of under Daniel, which is fine. It really doesn't matter either way. But after I put in my notes, we can then transfer records to you or the other veterinarian, so they kind of know everything. We'll just need y'all's contact information. That's why I was asking you as a vet to put it under them or under you. Either way is fine. We just can put contact information under Kalani's record and email that.
Okay, cool.
For us, it's always a first free exam for every pet that comes in. So the exam is complimentary today, and then it's just the anal gland expression.
Appreciate it.
Awesome, thank
Thank
you
you.
so
Yeah,
much.
so, yes, especially when you're coming in with dogs you're working on, it's a complimentary exam. and then
But
treatment.
by all means, when they're problematic like this, feel free to charge. I wouldn't be offended.
No, it might be different with the other doctors because we do have that autonomy to do that. But Firehouse generally, because we try to do social media, we do a lot of events where we offer first free exams. So I'm always going to honor that. And for me, it's just every pet gets a first free exam. So
Appreciate you, Doc. Thank you.
yeah, so,
That is awesome.
yeah, but yeah. So hopefully things continue to get better, and we'll follow up. With Daniel or you, we can kind of see how things go.
Yeah.
Right.
Yeah.
Okay.
I'll definitely keep you in the loop and update you. And
Yeah.
So.
You missed a spot.
yeah.
She's
We do offer, with any new client, we have some information about Firehouse if you're interested, a bottle of wine and a Firehouse tag.
Aww.
So, I don't know if you want to
What's your shirt say?
cheat on your other vet.
A woman cannot survive on wine alone. She also needs a dog.
It's not very fancy wine, so if you like wine, it might be a little,
Below your standards.
Yes, but we have a Cabernet Chardonnay and then we make Firehouse tags for new pictures.
That's awesome.
That is cool.
We can do that for you. So let me step out and let Jade know about that, and then I'll make sure we have your contact information. And you sent the records for the other.
Her
ones.
contact info is on the records I sent you.
Oh, perfect. Okay,
Oh,
good.
good.
Yeah.
Good. Okay.
Let me red or white wine.
Right.
Good.
Okay, you can always cook with.
She's awesome. What did y'all think about that?
I don't know if she has to have her glands expressed again. I'm not sure we can.
I can always.
Timing is everything.
Right. Timing is
I
everything.
think a clicker. I could never use a clicker. I just couldn't. I can't. It's either gonna click at the wrong time and then reinforce the wrong habits. So.
If the time comes, if and when the time comes, let me know. I'll come out.
Will you?
I'll come out. Okay. So don't even worry about that. But hopefully it was just a one-time thing that needed to happen. That's
The other thing I learned, those kinds of examinations, she has to have a muzzle.
mm-hmm.
She has to.
I mean, a lot of dogs do. I mean, there's a lot that allow that, but a lot of them do.
We
too.
were really lucky
Yeah.
with our first Melanie.
Yeah.
She, you could do anything to her. I mean, literally anything.
Well, but in the first 6 months of her life, she was
Oh,
poked
well,
and prodded.
she
and
was.
Needles and
Yeah. While we were trying to figure out why she had diarrhea all the time.
Yeah,
Yeah, she was in the hospital all the time.
Those are tough because that can go either way.
Yeah.
They can kind of become accustomed to it, or they can
Right.
make it worse.
I could do anything to that dog.
Yeah.
I mean,
Do you have a color that you call her?
A color?
Yeah. I have black, white, and smoke, or black and white. Is
Oh,
there a specific color?
I'd go smoke.
Smoke.
Yeah, the little like tan rust,
Right.
wolfish looking
The
features.
body side.
The ears.
Yeah.
she's trying to clean your floor for you.
Yeah.
I know. I think that's fine. Yeah. Does she have a birthday? Specific birthday?
6/11/24.
She does like peanut butter. Yeah, at one point we had to give our first Mel IV fluids.
Suck your fluids under the skin?
Yes, she allowed us to do that. We had to give her B12 shots every month. She allowed us to do that. I mean, this dog,
Yeah.
we'd always take her for vet visits, and they always were astounded how much she would allow them
Yeah.
to handle her without her.
That was fortunate, right? Fortunately, because that would have been.
Oh
It would have
yeah.
been the
Oh, and-
opposite. That
And she was
would've been-
120 pounds.
Oh yeah, she was much bigger.
Yeah, Kalani's only 70.
Yeah. She looks bigger, but she's
Yeah.
just all fluff.
All fluff.
We'll just follow up, see how she's doing.
Okay,
So I'll
cool.
have the tech team reach out to you in a few days.
Perfect.
So,
She's still working on it.
I know.
Well,
Well,
she
that's good.
stepped
That's
in
good.
it,
Then
so
her-
she's
I
licking
know.
her foot.
Then her brain gets a chance to focus on something else. you know?
Right.
And there are some dogs that even after the visit won't eat treats here. So her level of stress is even lower than some. So, let's see.
Well, what'd you think of the, I guess, the process? Do you have any feedback for us or any like concerns, hesitations?
No, I mean, I felt really comfortable. I trusted you. You know, I
Thank
mean,
you.
I'm pretty comfortable, like getting down on the floor. And she had the muzzle on, so. You know, I think just the communication of when to stop and start, because it is, and like I said, this is a higher level. This is more than an exam or looking at her ears, things like that. So,
And the muzzle flying off was definitely all right, yeah, let's pause.
Let's pause.
Let's
Because she
pause.
was like right there. And
Yeah.
I'm
but
thinking,
even when
yeah,
she
we
did,
need
she
that.
had
muzzle
she
punch
put her on the
pretty good
leash.
twice.
Yeah,
And she was like right here, and I had nowhere to go. I was like, oh.
Yeah.
Did she try to bite though?
No,
Yeah.
no. But if we would have continued, she definitely would have, and now there's nothing
Yeah.
stopping that.
The growling is, and the reaction are the warnings.
Right, I appreciate the
And
warnings.
then we have to, and then we're supposed to adjust. So, all right.
Your goodie bag.
Yeah.
Yay.
Okay.
So nice.
Okay.
Okay.
All right.
And if
Perfect.
you need the records, just let me know. I
That's
can
what I-
resend them.
No, that should be good. Thank you Dave,
Cool.
for that. So,
Cool.
all
Well,
right.
thank you. My goodness, that was wonderful.
great.
The mystery is solved.
Hopefully
Can we just check out in the front?
They should do it here.
Okay,
Yeah.
perfect.
Oh,
We
perfect.
Doc,
learned-
appreciate you.
We learned in
Thank you so
COVID,
much.
right, to check out in the rooms. And then we were like, why didn't we do this before? Then you
Right.
have like barking dogs and cats and terriers and the
Yeah.
front desk is on the phone. And so, you know what I mean? Just so much fun.
Right.
So, okay, all right. I'll hopefully see you tomorrow.
Yeah.
And then it was nice to meet you.
Nice
All right.
meeting you.
Meet you.
Thank you so
Thank you very
much.
All right. Have a good and eventful day.
You too.
Thank you.
Okay, guys.
What'd you think of that?
What do you mean?
The exam part?
Oh yeah. I don't know, like if aggressive dog owners or dogs with behavioral problems are just drawn to our clinic.
Yeah.
But-
So what you're saying is, we see this all the time.
Yeah.
Yeah, we
Daniel and
Kevin.
Kevin, that's what I thought. I wanted you to meet my hospital manager. This is
Hi.
Scott.
Nice to meet you.
Kevin, nice to meet you.
Nice to meet you. So, I don't know if you're able to, maybe you can go out there with me tomorrow, but I don't know if we'll be able to coordinate that. So, yeah. Cool.
Awesome.
All right. Mrs.
Nice to meet
Kalani.
you.
And she just got her anal glands expressed. So.
Aw.
All right, well, take care.
Thank you.
Thank you.
But yeah, I mean, if y'all ever have some like real problematic dogs and the owners are up for it, I'll be down to come out and help.
Yeah.
Cause
Yeah, I think we've already added you to like the here this is our available resources
Okay.
for like things. So
I can leave some cards too if that helps.
yeah,
Business cards.
We have yeah, you could definitely do that at the front
Okay,
desk. For
perfect.
Sure. Did you bring some with you?
I think so. I have some in the van. Yeah.
Okay,
Would
yeah.
highly recommend them.
Oh, yes,
Yeah.
absolutely.
Yeah, I actually heard about him from the person that I got my dog trained with, and she had very good things to say. So
See, and we're not from here. We're from Lubbock. Yeah, so I had been following Daniel for the longest time
Aw.
because we've been having such a time with her, and we finally just decided, because she was very close to us just saying, you know what, we
This is
can't do
it.
this.
Yeah.
And then we just gave it one more shot, and no regrets, man.
Yeah. I mean, it's
regrets.
definitely worth every penny. I had a
Right.
dog.
Oh, for sure.
I had a dog who caused my other dog. They got into a fight together, and my younger dog got extremely dog reactive. My other dog had to have ear reconstructive surgery, and I went and got him trained, and he's like the perfect dog.
Right.
Like can bring him under any high stress situation. He's like in heel, looking at me constantly, like does not care about any. He's the perfect dog. So, it's definitely worth it.
Yep.
Definitely worth it. So the only thing that we owe today is the 7D25 for the anal gland expression. You guys got a first free exam, so.
What does the exam normally cost? Just how much?
90.
90. Okay.
Yeah, but everybody gets a first free exam, a bottle of wine to go home.
Because after this, we're gonna need it.
Yeah.
But we're drinking on the way.
Facts. Just don't show up drunk to tomorrow's lesson, all right?
Okay. Understood.
Are you guys, is this like the end of the process?
This is her 7th week. Next week is she goes home on Friday. So
Okay.
we're on the back end of the 8-week process. They've been coming out every 2 weeks for 2 days and then going back, coming out.
How are the lessons going? Are you learning a lot?
Holy smokes.
It's crazy, isn't it?
There is a huge difference between behavior and obedience, and they are not the same thing.
Nope.
They are not.
Definitely because I mean, like, really you have to just learn how your dog thinks
Right.
in those situations and how to mediate those, like, output of expressions or output, you know?
Right.
So they're basically teaching you.
That is no lie.
Yeah.
That is no lie.
Let's see, Dr. Davis. But yeah, it changed my dog for sure. 4K1. And then do you want a emailed or printed receipt?
You can email it.
Okay. Let's see. I think we have Daniel's.
Yeah, you can email it to me. I'll forward it.
Okay.
Is that fine?
Awesome. Yeah.
Okay.
So yeah.
Works for me.
To you. Do-do-do. Yeah, we have dogs that try and eat our face off all the time.
Oh, I bet you
So,
do. I bet you do.
Yeah. We have tons of ways to work around that, but yeah.
Believe it or not, she's pretty good with our vet, except for
Yeah.
that rear area.
Yeah.
She does not like.
No, that makes sense. I think I tell a lot of our clients all the time, if I was a dog that came in here, I would be at bite risk for sure.
Yeah, facts.
For sure.
Yeah.
For sure. If you try and touch my butt,
Right?
yeah, good luck. But yeah,
Right.
we're fighting.
Gee, I don't know. How many human men won't go for a claw?
Yeah, right.
For much the same reason.
Exactly.
Exactly. Don't touch my butt. It's crazy. But yeah, you guys are all good to go. I'll
Perfect.
leave first, and then you guys, this is your room, so you guys are free to leave whenever.
Perfect.
Excellent. Thank you for the
Thank
time.
you.
We really
Thank you.
appreciate
Yeah,
that.
of course. Have a good afternoon.
You too.
Thank you.
All right.
Hi, how
Have
much
a good
longer
one.
do you have her?
Another week. She goes home Friday.
Okay,
Next
so we'll
week.
reach out to you next week.
Okay.
Okay, cool.
Perfect.
All right, take care.
Thank you.
Okay, yeah, nice to meet you all. Have a great day. Thank you.
Bye, y'all. Have a good day.
Thank you. You too. Kalani, sit. That's. Back up, Kevin. So she sees the dog. Ats. Bitch. Sit. Yes. So after everything Kalani worked through today, we wanted to end it on a positive note. See, dogs can become equipment smart. If you only use something when you need it, when the equipment's on, there's rules. And when it's off, there's no rules. I don't want the muzzle to be a uniform. I want it to be an accessory. Muzzle doesn't just mean we're going to the vet. It can also mean heel. It can even mean place. If you've been following along, I really appreciate the support. Make sure you subscribe so you don't miss next week's episode, where it all comes together. I'll see you on the next one.